Hey everyone, it's Mr. Cashflow. Today I want to talk about the most common HIPAA violations that can destroy a medical or dental practice. The Health Insurance Portability and Accountability Act, also known as HIPAA, was enacted in 1996. Since then, we've seen some major HIPAA violations that can cost up to $1.5 million per year. That can seem intimidating for your practice, especially if you don't know how to avoid a violation. So I'd like to briefly look at the 11 most common HIPAA violations. You need a clear understanding of what you should and shouldn't do so that you don't face a breach and potentially destroy your medical or dental practice. Number one is lack of employee training. Lack of employee training. Nearly 1/4 of the healthcare workers don't receive the proper HIPAA training that they need, but employee education and training can help your organization avoid all of the common violations on this list altogether. Number two, mishandling of medical records. Medical record mishandling using paper records increases the chance that protected health information, or PHI, will be left exposed for unauthorized people to see. Leaving computers unlocked also poses a risk. Locking your computers when not in use ensures protection of electronic records. Thirdly, using insecure technology. As we use more digital health information, medical records are more susceptible to breaches than ever before. And using insecure technology to share PHI is a huge risk that should never be done because it'll expose your practice to a breach. Number four, hacking and malware. PHI records are worth 100 times as much as credit card numbers on the dark web. So hackers are intentionally seeking PHI information. It's so important to have antivirus, anti-malware, firewall software installed on all of your devices to protect against hackers. Number five, lack of authorization and proper signatures. Some employees will carelessly release PHI because they don't know what's required in order to release it in the first place. Uses and disclosure of PHI requires written consent by authorized individuals when it's not being used for treatment, healthcare operations, or payment. Number six is incorrect information. It's simple. Double check or even triple check the information that you're releasing, that it is the correct patient's information. Number seven is improper storage and disposal of PHI. While people probably don't go through the garbage searching for PHI, it's definitely a best practice and recommended that you dispose of it properly through shredding, destroying, and hard drive wiping. Deleting is not enough. 8. Lost or stolen devices. Human error is uncontrollable, and you can't really prevent a stolen device from happening in the first place. Your organization must have the proper safeguards in place so that PHI is not exposed from these stolen devices. Number 9, misuse of social media. Using more social media increases the chances that a patient's photo will be shared on the internet. Employees have to be cautious about what they post on social media, ensuring that it doesn't include anything regarding patients. Number 10 is casual conversation. Call it gossip. Stories about patients may be fun and interesting, but discussing PHI is always off limits. That includes gossiping about patients to friends, family, or even co-workers. You never know who might be listening and what they might tell someone about. And number 11 might be surprising, but it's celebrity file lookups. Not only can talking about patients be interesting, so can snooping into their files. Very common with celebrities in particular, and even with no intention of sharing the information, if it's still a breach of PHI if you look at files without authorization. HIPAA violations can be disastrous to a practice. Compliance is not a suggestion, it is mandatory, and non-compliance can be very, very costly. Don't risk it. Cashflow Strategies, Inc. is pleased to work with PCI HIPAA and OfficeSafe to provide your practice with the full solution to compliance, training, and protection. Contact me today and I'll be more than happy to provide you with a free HIPAA risk analysis for your practice and help you ensure that you're totally compliant and not at risk of a breach that could destroy your practice and everything you've worked for. And also, if you would, like and subscribe to both my blog, mrcashflowblog.com, and my YouTube channel to get more tips on boosting your cash flow and keeping your practice safe. Cash flow strategies. After all, it's your money. Keep more of it.